Todd, we're who are you? That hat
James,
is awesome.
you, you can't outdo me with your cowboy hat. I got my steampunk hat on. Yeah,
Well,
we're looking good.
this hat's in honor and respects of Texas, and now that I'm on the edge of El Paso, oceanfront property, North El Paso, I had to go Texan in my heart. I'm really a Texan man, if you really think about it, because as a kid, I used to always read stories about Daniel Boone, all the Houston and how Texan became a country. You explained that yesterday, and I'm just displaced. That's all.
That's right. California is okay. That's a good. If it was a country, it would be okay.
Yeah, well, we're having fun, and I really have enjoyed FaceTiming with you, and this kind of came up less than 2 weeks ago. We didn't even know we were going to be doing this, and
Nope.
it's actually been really helpful for me in my heart. It gives me a purpose of being busy. I have to be busy on something, and I just am thankful that we're doing this, and we've had just the generosity of our guest coming on board, and I'm really excited about this one. This was one of my first thoughts because I didn't know, I
Yeah.
don't know Sarah well yet, but I've followed her on Facebook for quite a while and watched her skill sets. And, I've been doing this 37 years, but I can learn something new every day. And, and I just love this community that we're in. So how you doing? How you doing? And particularly with a hat on, are you thinking a little differently with the hat on?
Yes. This gives you a whole bunch of different thinking with the cogs actually right on my forehead. It
I
gives you a different way of thinking about things.
I have a different sense of energy.
Oh man, I'm like going back to the 1800s in my mind as we speak. You mentioned staying busy.
Yeah.
I think that's what a lot of people need to do. And whether it's fun or, hard work out in the yard or, cleaning a closet out at the dental office. I mean, you gotta stay busy. You're going to go crazy,
Yeah.
right?
Yeah.
And I do appreciate James Clem that we have this avenue to reach out to people and so keeps us busy as well.
Absolutely. But
Well,
we're getting a lot of
yeah.
highs on Facebook already, and people are coming through. And as we go through this, I'm handling the broadcasting software, so that's why I get a little more quiet. And
Yeah.
and I'm learning how to multitask, which is we have to do it chair side, but to do it on a computer screen, it makes me feel young. And I sure enjoy it a lot. So go ahead, take it over,
Does it,
Todd.
uh, does it make you feel like a cowboy?
Cowboy multitasking and being a computer geek. I think I kind of like the new image.
I'm never going to look at you the same way without a cowboy hat. So anyway, hey, without further ado, let's bring Sarah Jockin in. Just one of the major
Yeah,
lead.
there she is.
Yes, and she's got her hat. Tell us about your hat.
Well, this hat is about the fanciest hat I have. I'm not often a hat wearer, but I love this one, and I'm feeling very Texan right now. Is that what you say, Texan? Is that right?
Yeah.
What's that?
Okay, but I am really in Florida. Today was a little bit of a stormy day, and we were concerned the power would go out. I couldn't speak to you if the power were out. Luckily, it didn't. My son wasn't so concerned because, he would only search the internet for something, and he has told me that he now understands that he doesn't need the internet because who needs Google when your mom knows everything? So
there you go.
I figure I'm maybe a reasonable host. He's probably ready for a substitute because I'm making him get up early in the morning and run with me. All those things that you try and do to stay busy because I can't sit still. It's just driving me crazy.
What grade is he in?
He's a middle schooler now, so he's in 6th grade. And man, I thought puberty started way later, but I think we're there. He's just nothing's cool anymore, and he just wants to be in his room with his friends on the screen.
Sarah, middle school was special for me because that's when I met my wife.
Oh, really? Tell me.
4th grade. Well, actually, a little before middle school, and we were at this little school out in the country, and there were 4 of us in 4th grade, and we were in this 4th grade room. And she was sitting behind me, and I could always feel her staring at me. You know, when someone's staring at you, and you turn around,
Yes.
and you get all nervous. And then we started playing at recess and sharing our lunch, and that's where it started.
The rest is history.
Yeah.
There you go. That's an awesome story, James. I
Yeah.
didn't know that story about you.
So we've known each other over 50 years now.
Wow.
It's
My
hard to believe, but you know those memories. Every time we go back to that location, we go to the school, and it's now like a health club. But we go into parking lot, and we get those feelings that come back, and that's, you know, we have to deal with our feelings, and that's kind of what we're doing today. We're dealing with our feelings, with what we're having to deal with this shutdown, and just a change of life that we're all having to pivot a lot,
And it
both
happens so
emotionally.
fast,
Yeah,
right?
yeah. Go.
Yeah, it happened so fast. Last I saw you, Todd, was in Berlin in January, and we never thought this was going to happen. And then, James, did I see you at Midwinter?
I couldn't make it. I wanted to be
Okay.
there, and I due to some health issues, I haven't been traveling for almost about 3 years unless it's on the West Coast. So
Okay, gotcha.
yeah,
Hey, more power to you. It's amazing how, and Davil said that, how he used to travel during the weekends and be at work during the week. And I had a similar schedule, and I was really starting
yeah,
to feel the burnout a little bit, but I didn't really stop to think about it. And so this kind of forced sabbatical that I think none of us will have again
yeah,
until we
yeah,
retire has allowed me to kind of slow down and get back to
yeah.
what I need as a provider. You know, self-care is really important. And my back feels better than ever. I actually walk straight and not in a circle, and it's great. It's fantastic.
Yeah, I was telling Todd yesterday is that, you know, I have this lumbar 4-5 thing, and then my right leg is starting to go a little numb and weak. And since I've been out of practice now for over a month, I was walking last night, not even thinking about it, no pain. And I go, oh, wow. Because I love dentistry. I want to do it a long time yet. And yet the body starts to wear out. But I learned a few things about myself.
Sarah, so
Absolutely.
what are you doing on the downtime, and what are you doing with your team? What are your plans on getting started again?
Yeah, we're still connected. I think it's really important that we stay in touch with our team. They don't know what's going on. They're just as confused as we all are, I guess, even though I think it's good news that we're thinking about reopening and preparing. So now we're at this point where I feel like we're kind of past the worst of it, hopefully, and we're trying to slowly and smartly re-engage. And so we have a team call, like whether you use Zoom or Teams or Skype or whatever, once a week to just all check in, and people share about how they have been spending their time and give each other positive reassurance and motivation, really. And then some of them come in still a little bit, where if we need to really see a patient, they have a couple hours here or there. And it feels really good to be with them. We notice how much we miss each other. And I notice how much I miss dentistry. The other day, I had a situation where I just had to go in quickly. And sitting in that chair, it felt so good. I felt like I was home and I knew what was going on. I was in charge again. It just was so reassuring, and it showed me how much I love dentistry and how much I miss it. It's been good. That part's been really good.
Yeah, times like this kind of define your true passions, don't they?
Yes.
Yeah.
You know, one of the things I'm seeing a lot on Facebook, and it kind of concerns me a little bit, and I think my biggest concern is not so much for practices maybe like ours, but you know, that new startup practice. They just got the loan 6 months ago, and they were just trying to get their basis of new patients. You know, interesting kind of history. What would you say to those people that are really new and struggling in their new practices?
And I think that's a really valid point. Also, people who are recently graduated, who have tons of student loans to pay, even if they don't have their own office.
Right.
I think this community gives a lot of help, because we never thought we were in a situation where we would watch webinars on whether to lay off or furlough people. You know, like, who knows about that stuff? Now we all know about that stuff. And I think, I'm part of the EPIC tribe, the women in dentistry here, that And it's not all just women, but as a group, as a CEREC user, as a dentist, as a fellow dentist, we have that camaraderie that is really strong on the online platforms and also amongst individuals. And I think that gives me a lot of strength. Real big shout out to everybody. Really, how we have come together as a group and learn to live through it, because we all knew we were in the same boat. We are in the same boat, and we have to get through it. It can't be that all dentists will fail. So I'm hoping that this community that we've been able to create, and thank you so much for reinforcing it, because I look forward to, you've done a few of them, and now I'm starting to look for, when are Todd and James speaking? And it really gives us hope that we are in this together, right? And we'll get through it. We'll absolutely get through it.
Yeah.
Let's try to get through it at the other end, that we're strong and positive and we're ready for our patients. Because our patients, see, the thing with the restaurants and the bars is if you miss a meal, you're not going to make it up.
Right.
But the tooth problems don't go away. So the bars and restaurants, they'll just have normal flow. We're going to be just crowded with so many patients who need care. There's going to be such a backlog. So I think financially we'll be just fine. So that concern we can kind of put on the back burner. The important thing is that we get to our patients in a reasonable way, in a safe way, and that we treat the ones that need it most as soon as possible. And especially, I'm passionate about implants, especially with implants. There are things that can't wait, and we need to get those patients back in. So let's start to re-engage. And depending on the state where you're at, you don't know when you're restarting. But like you said, Todd, it's going to be May, it's going to be June, it's going to be sometime soon. Right?
Do you, when we are all coming back, do you think it's going to be a fire hydrant of patients, or do you think it's going to be a drip, drip, drip of patients coming in?
I think it's going to be a fire hydrant of limited exams and a drip, drip, drip of prophies. That's what I think it's going to be. So maybe the days will change a little bit. Maybe we'll do fewer hygiene checks. Maybe, we try and reduce point of contacts. Maybe we'll do a hygiene check once a year versus every 6 months. I don't know. Everybody does it differently anyway.
By the way,
I think the change will be in who comes to see us, not the volume.
Yeah.
That's what I think.
That point of contact, I've kind of set up my practice of where we let our clients know. And of course, the hygienist I work with, my primary hygienist, has been with me off and on for 30 years. And she's she's an extension of me, and I'm an extension of her. And I see a patient once a year, and they trust her. It's not a question. You train them, you bring them in, and it will work. It will work. But we are going to have to pivot a little bit on some of the way we do our clinical approach.
Yes, and I think that maybe it's also time to create a daily flow where you see fewer patients at a time, and maybe just schedule it differently. I also saw something interesting where there's this high suction vacuum that is extra oral. Have you seen that? It's a freestanding unit, and it just basically sits in that space right in front of the patient, and it sucks up the plume. And that seems like something that we might implement. I'm not sure. I haven't really checked it all out, but it's definitely something I'm interested in.
My thoughts on those is, maybe it's we need them. But what I'm telling my circle of friends is
right.
Don't make emotional purchases. The science is still very much out there. Some science is showing that it is very aerosolized, and then others is saying it's not. And so I'm going to wait. I'm going to wait before I start buying any of those things, and knowing that I'm going to tell my patients that that's the cleanest room they're ever going to be in, and then we'll figure it out.
And it already is. It's already a very clean room. And
yeah, because nobody's in it. I haven't seen anybody in there for like 3 weeks. Of course, it's dusty. I need to go in there and dust it off. Sarah,
well, I sure hope that it'll put some emphasis on hand hygiene and, in general hygiene at the dental office. So we've always used universal precautions. So in the end, we're already safe, but we need to let our patients know.
It's going to be about perception as much as anything else.
Correct.
And, Todd, you said something several webcasts back where we're going to have that conversation with people. And it's always been my goal, particularly in connecting with my patients through the years, is making sure they always feel safe and secure. Uh-huh. And a lot of that comes through our leadership, but a lot of comes through, Karen said, she mentioned this comment of where, I'll do this occasionally. I'll go to my treatment room, sit back in a chair without falling asleep. Try to.
Mm-hmm.
And then I'll look around, and you'll see something that other patients see that we don't see because we're so used to being
Yep.
in that room. So
Yeah, my pet peeve is seeing the light up top and then it's not white, that reflective surface, and it's just calcified and it looks all streaky and it just looks terrible.
yeah.
Hey, James, I'm going to give you some advice though when you get back to work.
I need
You
advice.
probably don't want. Well, you probably don't want to wear your cowboy hat. That's probably going to scare some of your people.
Wait, I'm feeling so good
But
with it.
bring Jordan.
Hey, Sarah, you know what? I just
Bring Jordan.
realized this. You know that marijuana smoking is big in California, apparently. Did you know that? And do you know what today is? Today is
Oh, it's
420.
420.
James right now has a whole parking lot full of patients ready to get in. They're all smoked up, doped up, ready to do it. And they don't know why the doors are open. 20.
Pre-sedated.
Pre-sedated. There you go. You know what,
So,
Sarah? Right now, my Jordan here is trying to get in the picture.
getting back to your favorite thing. Oh, sorry. What's your favorite procedure to come back to, Todd?
Our procedure?
Yeah.
I'll be honest, I haven't figured it out yet. We're in Texas. I'm pretty sure it's going to be May 11th. That's the day we're scheduling for. And we're going to have some meetings over Skype and some different ways. But, I'm not sure. I'm not ready to make that commitment yet because I think it could change in 4 or 5 days.
Oh, okay. That makes a lot of sense. Sorry, I wasn't clear. What dental procedure are you really looking? What are you missing the most? What's your favorite dental procedure you want to come back to?
Well, first of all, if any of my patients are watching, I'm going to practice on some dentiforms, which are the fake patients, just so I can get revved up again. We got to get our, where the rheostat is and everything. Sir, I kind of like you. I like dentistry. Even though I do a lot of CEREC restorations and veneers and things like that, I like doing it all. I don't have a favorite really. I think what I'm really going to enjoy is just seeing the patients back in it, and I'm starting to establish the normalcy again, even if it may be different. So I'm really looking forward to the people more than anything.
I hear you. What about you, James?
I'm just looking forward to getting back and connecting with my clients again and seeing my team. I really miss my team a lot. I'm with them as much as anybody else in my life. And, you get that connection. And my team members have been with me for years. And maybe I'm a little depressed because of that. It's just dentistry has been my life for 37 years. I've never taken a full month off. I've taken time off, but it's usually a week at a time. And this is really new for me. And but I'm looking forward to getting back. By the way, here's a comment that in fact I started getting into placing implants after 2008. And what I found is prior to 2008, I had like a niche aesthetic practice. That's all I did.
Mm-hmm.
I even referred out general dentistry. Can you imagine that? And then in 2008, it's just like it dropped overnight. But I noticed that people were still doing their implants during that time.
Mm-hmm.
And if I had any advice to anyone right now is broaden your skill sets. And I have to do a shout out here for you, Sarah, right now, because Sarah just got her fellowship. You want to tell us a little bit about that in implants?
Yes. So I first credentialed with the American Academy of Implant Dentistry, but then did my board exam with the American Board of Oral Implantology. So now I'm a board certified implantologist, which in California means something different than in Florida, actually.
Yeah.
So love that part because you can take the patient start to finish, right? But even if you don't want to place implants, I think broadening the skill set is fantastic. The stats show that most dentists, for example, don't do chairside implant restorations. So if you like the restorative part, only about 20% of CEREC doctors use their CEREC machine to do implant restorations, which surprises me because it's workflow. Both of you know it, both of you teach it, and I really am hoping that a lot of dentists have had time to just broaden their skill set so that they have the confidence to put them into action when they get back.
One of our common themes is that we're all into the digital platform, and one thing I like about that is, I don't know, maybe I have control issues, and I always have, and I like having that control, but more than that is that I have found that when we have our own creation, you place that implant, you restore it, you're giving yourself to that patient, and you forever have a bond. You'll see a patient in town and you're going, oh man, we're connected for life because we've developed skill sets. And that's what I'm encouraging everyone else to do right now, particularly within our neighborhood and our niche of digital platform, is like develop your skill set. And you're going to need it more now than you ever have when you come back, because that can be your creative avenue to keep your practice alive. And I just think it's terrific.
Absolutely. I wholeheartedly agree.
Now, Sarah, tell me a little bit about your practice. And you're in Florida. What part of Florida?
I am in Tampa. This is where I started it from scratch. So after graduation, I moved to Florida, and I started it with two ladies, one in the front, one in the back. And, I was doing my own prophies. I was doing everything. And then I earned my first hygienist after 3 months, and installed a CBCT right away. So in 2011, I think I was one of the first people in Tampa to have one, and just exploded my ability to diagnose things and then also to treat things. And then when the Omnicam came around, I jumped on board with that to make my own guide. So Sarah Guide 1, that was
yeah,
that was quite something. Wasn't quite ready for prime time yet, but then Sarah Guide 2 came around, and that solved that issue. And then we just kept growing. I got an in-house lab tech after about 3 years because I really wanted to deliver the highest quality care I could with things that I couldn't do with Sarah. It was a removable lab tech. Cheryl, she's fantastic. She did all of Pete Dawson's frameworks in the 80s. So super skilled lady. And then it kept growing. I got a ceramist after that, Henna. She's the one who makes all of the teeth that you see me post on Facebook. And really practicing with an in-house lab is so fantastic. It is just so amazing. Talk about control, right? I have control issues too. And then we grew with associates and actually outgrew the space, built a practice from scratch. And as I was speaking more for Dance Restaurant and beta testing more, Todd, remember the Prime Scan when we first got that? Lots of fun, lots of kings, more fun. So that just took so much of my time outside of the practice that I decided after several years that I would let go of the management piece, actually. So last year I affiliated with Heartland Dental, and I've been having a fantastic experience. Really still practicing the same. Nothing's really changed except for I don't do the billing. I don't do payroll. I don't own the building anymore. And continuing to teach, really loving it. I've used this break to refine my GP implantology curriculum that I deliver, usually in a microgroup setting, up to 6 doctors, so that everybody can see and everybody can participate and nobody can hide in the crowd. That's how I learn best, in a small group. And loving this. We live in a great time in dentistry. If you think about it, 50 years ago, we wouldn't have done anything digitally. 150 years ago, we wouldn't even have known how to numb our patients. I mean, there's no way I could have been a dentist at that time. But now we do click, 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 and here comes the guy that puts everything where it needs to be. And so predictable.
With that said, what do you think is next in dentistry?
Oh, what do I think is next in dentistry? I hope printing will really get to the point where we can eventually print ceramics. Wouldn't that be cool if we could print a crown in 5 minutes or something like that?
And everything's digitally, and so it customize all the optics that we need, from saturation, translucency. My issue is I want to stay alive long enough so I can experience that.
Yes. Oh, you will. You will. I'm sure you will.
My guess on what's next in dentistry is trans tissue imaging. I think X-rays are going to be long gone. Yeah. It's going to be like a. I mean, if I knew I wouldn't be on here, I've got a patent on it somewhere. I'd be in the Bahamas or something. But no, I think we're going to have scanning ability that will see through tissue. And why would you need an X-ray anymore? You'd be surface texture, density, maybe pulse, who knows, maybe temperature, pH. So I think that's probably going to be in our clinical lifetimes. Wouldn't that be cool?
That would be cool. I think if you find the right wavelengths, Todd, you'll make it happen.
Oh man, it's not that smart.
My undergrad was in nuclear engineering. And what it does. And actually, what you're saying makes sense if you find the right one.
Yeah, I think that's right around the corner. I think printing obviously has a lot to expand upon because it's pretty rudimentary right now. And the other thing I think will happen is material advancements. Right now, I mean, everything we do manufacture materials based on the limitations of the materials, prep designs, whether you mill it, print it, whatever. So we need our manufacturers out there working on new materials.
I'm all for it. I'd like one that is really beautiful, is made really fast, and you can see through it in an X-ray. Go.
That's a lot to ask for right there. Yeah. I don't know if you want to go down this rabbit hole, but zirconia is great. I think it's way overblown. There's so many other materials that get set aside that are totally good for teeth, and kind of on the zirconia bandwagon that I don't think we need to be on so much.
I don't use that much zirconia because I don't like how I can't see through it on the X-ray. And if I want to see if my frameworks are seated or if my crown is seated or whatever, I just can't see it. They're so beautiful, though. It's really hard to not look at them as a just incredible restorative material.
Hey, so now that you're a fellow in this big fancy implant group, what do you think of zirconia implants? What's your take on those?
Yeah. I think they're too brittle. I think they're just too brittle. It would be so hard to know long term that you didn't include too many stresses because bone isn't uniform. So upon insertion, you know that you have stresses because some areas of the thread have screw to bone to thread in contact when you thread it in, and some don't. And so I think that you can't sinter it afterwards. I wish there was another option, but I don't know why we wouldn't just stick with the titanium alloy.
All right. Well, I was going to have you do my zirconia implant, not now.
Oh, Todd, I'll do it as an exception. I had it set up and I didn't see it coming. You got me.
No, I just get
fine. We have to do it socially distant anyway. Let's do it through the
robotically. We'll do a robotic approach.
Anything for you, Todd.
Well, I really enjoyed getting to know you, Sarah. You're a great person, and thank you so much for joining us. You're a breath of fresh air for sure.
Oh, huge pleasure. Thanks for guiding me through it. I was a little nervous, but you two are such pros. It was nothing.
Well, Todd and I connected through the digital platform, and otherwise we wouldn't know each other. And we know each other because we're associated with similar products and also Dentsply Sirona. And I would have to say Dentsply Sirona, at the time it was Sirona, has changed my career. I mean, digital CAD/CAM changed me as a person, and it makes me want to go further in life. And then I admire so much with what you have done with implants. And I always encourage people in my classes to become very complete and definitely have the ability to place implants, particularly if you're wanting to grow a practice. That needs to be part of your portfolio system. And I want to take one of your classes. I learned so much from other people, and I'm just a CE junkie. I really am.
You just made my day, my week, my month.
Yeah,
That's awesome.
And there's so much I can learn. In fact, one thing I love best about education is learning. I learned more from people attending classes and making little comments and say, "Have you tried this? Have you tried that?" And it's a humbling experience because I found the longer I practice, the more I know, but the less I know also because things change.
You know your limitations better.
Things change so quickly, and I just love the flow that we're on right now, particularly what digital dentistry is doing, and that's how we all got connected. And just think about that. We'll know people we never would have known otherwise by just the choices we make. So thank you.
Hey, James, I got an idea. This is a good discussion. Let's keep it going just for a few more minutes.
Yeah.
Is that good?
Is that okay, Sarah? I mean,
absolutely. Tell me your idea, Todd.
You're feeding the energy.
Well, no, Yeah, no, this is
Oh,
good
to keep it
discussion.
going. Yes.
We'll go
I
about
think
another
that
10 minutes.
actually learning will change a little bit because these webinars are showing us, we can really exchange well because it's live. Maybe we'll do more learning online, and when we meet in person at these sessions, it's more live surgery, actually hands-on stuff to deepen the learning that you've gotten while you're doing the prep work with the webinars. I could see that happening, actually, more and more internet learning.
Yes. Yeah. So if you could all, I was thinking about this the other day. I don't know why. If you could only have one material, one indirect material, you don't have to do a brand name, but you can do a generic term.
Well, I would say lithium disilicate.
Yeah.
No, I want. Yeah.
I'm an Emacs girl all the way around, and I've just had good success with it. If you don't push it, if you don't make it too thin or in the wrong area where it's not indicated, it just really does well for me. My personal opinion only.
All right. So if that's the material, what is the one procedure you would do if you were limited to one type of dental procedure?
Extractions. For sure. There's
Really?
nothing
Okay.
satisfying.
Yeah, not like in a
There's
heartbeat.
nothing as satisfying as getting the infection after tooth removal removed and get a clean, dry, bony socket that barely bleeds because finally all the junk is gone. I can sense how the body is relieved that that's been removed. That's
Man,
definitely.
I'm about ready to throw up. Blood makes me throw up. I can't do that.
Oh. Is that why you haven't replaced your tooth, Todd?
No, I haven't done an extraction in probably 15 years. Actually, I did one last year. There was a guy, and I was like, well, I'd probably grab it with the gauze, and I did get it out, but I sweated through the whole procedure. It was tough. James, what if you had one procedure that's all you could do coming back, what would it be?
A single central. I love them.
Oh, wow. The challenge.
It's not because they're easy, but we have the skill sets to bracket, use different ceramics. And to me, it's always like, not that everyone is perfect, and it's not about perfection, it's about harmony. But I always tell people in this journey, if you want to master aesthetics, if you can do one single central, you can do anything. There's so much involved in that. And I love the art side of dentistry. I like connecting with people, but I always told my wife when I get matured and I'm no longer practicing, if I still can have a handpiece and ceramics to grind on, I'll be a very happy old man.
Yeah,
you know what I'm gonna do? You know what I'm going to do if I only had one procedure or one area? I want to be a specialist on upper right premolars. Like, I would be the go-to guy for these two teeth right here. I will extract them, implant them, endo them. How great would that be? Yeah, I mean, the anesthetic is easy. It's right on my side.
Todd,
maybe the lowers, though. Would the lowers be better? You can look at them. You don't have to do indirect vision.
I don't want to do blocks. I want shorter needles.
I see. Yeah.
Well, hey, Todd, true story. I was teaching up in Seattle several years ago, and one of the doctors there was in his 70s, and he was there hanging out, and he had just sold his practice with the agreement that he just does premolars, and that's it. That he still loved dentistry, and he loved CAD/CAM dentistry, and he said, my specialty are premolars. And
I love that
it's
guy.
possible. Yeah. So, by the way, lower premolars, Todd, will be better on your neck, just so you know that. Sarah had a good point there.
And you know what? If you do it with articaine and you push on it, it'll actually numb the second premolar too. It'll work. But
okay,
yeah,
I'll do
that's what I learned from
lower
Element. You got to push on it. You can't just deposit it right there. You have to push on it.
I don't do that many blocks anymore. Even on lower molars, I have a 3D on everybody I work on. I have a lot of elderly clients, and I can look at the thickness of the cortical plate and get fairly profound anesthetic on lower first molars when you're not dealing with a thick bone area. And
do you use a special syringe, or do you just use a normal syringe?
I use the comfort syringe because I'm a really sensitive person, but I think part of profound anesthetic is not over acidifying the tissue.
Okay.
And so I've used bicarbonates as well. That actually helps. Where I mix it, and then the Onset new formula works really well. But articaine was a huge difference. I was teaching at LVI at the time, and our attendees from Europe were coming over with articaine, and we just fell in love with it there. You have to be careful with it, though. Some people react to it, but most of my lower molars, if there's not a really thick buccal-cortical plate, we're getting pretty good anesthetic on first molars.
Are you just infiltrating, or are you doing a PDL injection?
I'll do infiltration and wait 8 minutes. That's my secret. 8 minutes.
Okay.
And then if they're the sensitive type, maybe I'll do I'll do a PDL, and I'll use the comfort syringe, and that's very, very effective. Yeah. Yes.
Can I try that on my patients? And if it doesn't work, I'll say it's the Klim technique, or do I not?
well, you can try it. I used to do interosseous all the time. In fact, I did a lot for lower molars, and I was doing comprehensive prepping. I would do interosseous, which is interesting. You got to be careful because they need to be healthy, and they can get a rush and all that.
Heart can jump real fast.
As I've gotten older, I've gotten a little more conservative. I look at people's health carefully. I'm very conscientious about people. Part of it's because I'm really, really sensitive, and I actually feel people. As I've gotten, maybe it's because there's reasons for that. I'm married to a therapist, but Todd, I got to have this conversation with you right now. As we get older, our estrogen goes up. Did you know that?
It does not.
Yeah, it does. So as we get older, our estrogen goes up, and we feel more things. I cry at movies now, and my wife loves it. And I feel more things. I'm in touch with people. I connect.
I got to go ride my motorcycle. I'm out of here, people. I can't deal with more estrogen.
There is science behind that. But having said that, no, as a dentist who's just really sensitive, I've kind of wrapped my practice around practicing so that connection happens. And I hate running behind schedule, but I'm kind of getting off base right now. But I think it's the hat. There we go. I had to switch I'm back in order.
You got to be tough with that cowboy hat on, brother.
I know. I'm feeling it.
Sarah, you've been a blessing.
Yes, Sarah.
Just an amazing time.
What a fun time with you two. Let's do it again sometime.
Oh, I'm putting you down right now. I got a whole list of people, and we're gonna have you back on for sure. You're a blessing, and we love the epic ladies for sure.
Yeah, we do.
And we're honored to be some of the first. Karen did great the other day. That was a great inspiration.
Just so you know, I'm a huge fan of the epic ladies. I follow you folks.
And we are of YouTube.
And
look, I've got my tie pin.
Ah, nice.
Epic lady.
That matches this necklace, my dear.
Oh, very good. Well,
that's the epic necklace.
Sarah,
estrogen is up
Karen
now.
was wearing a bracelet. We have a piece of jewelry for everything here.
Yes. Sarah, in the future, I'd love to do an interview with you where you could do a step pathway for people to integrate into placing implants, because I feel like everyone needs to be doing that, even those that are a little scared of blood.
Would love to.
Right over there. And I didn't start placing implants until later in my career, but I kind of cherry pick. I pick and choose. I know my stuff, but I did it because I didn't want to, as an educator, I learned so much from placing them, particularly in restoring it, because I'm a restorative dentist. And when I look at someone like you with what you have done, I just so highly regard your skill set. And your temperament and your ability to connect with people is just second to none. So, and I'm saying that just because I mean it.
Thank you. That means a lot to me.
And so what that means is that you are going to be able to just be a major influencer on other people. And one of the reasons why I educate, and there's been different reasons, but particularly now at my stage, is not about me. It's about helping others make better choices so they have a better life. And
so rewarding.
That's what drives me, and because dentistry is a great profession, but it's a very comprehensive profession. In other words, you have to wear a lot of different hats, and so and like you're saying, Todd, it's a lot of different hats. So no, it's been great having you on board today, and I have thoroughly enjoyed our get together online here.
Thank you so much. And you know what? If I can do it, anybody can do it. This is not rocket science. This is just using regular principles that we can all learn and applying it to our patients. So I would highly recommend that everybody who can managed to do a DO on number 14, composite. You have the surgical skill to develop into an implantologist.
So, Sarah,
no question.
Sarah, I need to ask you a very focused question right now. So if you had a doctor who came in who said he just wanted to do premolars, and that's it.
Yeah.
Right?
Yeah.
You would easily be able to guide him in a bloodless procedure. So he would have a new skill set that would just fill his heart in such a way where he'd be a new man or a new woman. You never know.
You never know. It's true.
Let's make it number 4. I can take number 4 out. I think I can get 4s out. That'll be okay.
You don't even have to take it out. You just take one that already has a healed ridge and you just slap one in there. 2 drops of blood is all you should see.
All right. I know when I've been digitally shamed. That's okay. I understand. So, all right, Sarah, thank you so much.
Thank you.
So,
everyone, give Sarah love. And we look forward to connecting with you again. So I'm going to sign off with Todd here in just a moment. Sarah, thank you so much for coming. It's been great to get to know you better.
Yeah, amen. What a blessing she is.
Oh, what a blessing.
Yeah, we need to have her back. I had so much fun talking to her. Hey, we have Alex Nudell tomorrow with Revenue Well. And if you're up to it, we may have a surprise guest right after Alex. We'll talk. So it'll be fantastic. So, and I'll get a picture up here in a minute of the rest of our schedule for the remainder of the week. James Clem, I had a blast with you today. Just awesome, and I hope everybody else has as well. So thank you for everybody that's been on so far on our shows.
And thank you for watching. And our model here is it's all about hope, right? We got to give everyone hope. Get your skill sets, grow your skill sets. We've got to have hope now because we're facing things that we've never faced before. But I know I dig deep in many ways, and I go back to the faith of my father that helps me give me hope. But our goal is to pass it on to others. So thanks for watching today. And Todd, I like that hat.
Oh, man.
And I loved Sarah's hat today. Maybe this will be our new theme.
Yes, we're going to wear girls' hats next time.
So we're going to sign off. We'll see you tomorrow. And love